Yeah. Okay. Well, we've been talking about lifestyle, and changing that, and talking about diet and exercise. I got to tell you, man, this stuff is hard. Donuts taste really good. Going to the gym takes a lot of time. If we could come up with a pill or an injection that could help us with weight management, some of these things you're talking about, that would be great. Oh, wait, I just heard about one. Oprah's taking it. All the stars are taking it. They're losing tons of weight. I would love to talk to you about this topic.
Yeah.
I think it's really easy to get into this world of low carbohydrate and carnivore diets and think this is a cure all. This is going to
Yeah.
fix everything. You don't need to do anything else. Pharmaceuticals suck. There's no room for them anywhere. And I'm not quite ready to say that. And you have a really interesting and nuanced way about looking at some of these different drugs. We could be talking about Ozempic and semaglutides and all these trendy words and drugs that we see advertised all the time. Tell us a little bit about the new development, this latest wave of drugs that seem to be extremely popular.
So this is it's first of all, the environment right now is that it's the Wild West out there in terms of these medicines being prescribed. Easily accessible on the internet, not, I think, a lot of thought or effort put into the medical evaluations. These medicines should not be used without a comprehensive program like we have been talking about over the last hour. I think low carb strength training in particular, because you lose muscle mass on these medicines. And so I do believe the genie is out of the bottle, and that these medicines are going to be used. The drug companies are going back now and trying to find whatever indication for them that they can. Oh, it's going to lower cardiovascular disease. Oh, it's going to treat fatty liver disease. And I can't really completely disparage the medications because I'll be honest with you, I think this is a very positive development in pharmaceuticals for some people. The problem is that they need to be used very limitedly and very judiciously. Because kind of the standard right now is, again, we're just going to throw medicine at the problem. People come to me and it's like, hey, we're going to do the lifestyle things before we even talk about any medications. I do use the medications. Let's give a little bit of background on them. They're once weekly injection. We're talking about Manjaro and Zepbound and Tirzepatide and semaglutide and Wegovy and Ozempic. They're all in the same class called GLP-1s. They work three ways. They slow gastric emptying, so they keep your stomach fuller for a longer period of time. They lower blood sugar, which we just talked about. Originally, they were used in diabetics, and they were found to lower blood sugar but not cause hypoglycemia or low blood sugar. So people lower their blood sugar, they're burning a little bit more fat, and then it has a direct effect on the brain and the hypothalamus to decrease hunger. Um, so I think that consideration, if diet and exercise does not get a person where they want to be, a consideration of very limited temporary use of these medicines may be appropriate in some patients. Now, unfortunately, what's happening right now out there is it's like people are getting prescribed medicine and not as part of a program. They're just like, here's the medicine, good luck losing weight. And the downsides of this medication are the loss of muscle mass and the weight regain if and when you go off the medicines. And I don't feel it's appropriate to start a medicine on some people that's not, a critical medicine, a life-saving medicine. Start a medicine on somebody, you could say maybe for vanity reasons, it's being taken that way a lot of times, not just for metabolic health. And then because they are not doing the other things, commit them to lifelong dependence on this medicine. So the way I use it is I usually don't start it right out of the box, right out of the gate. I usually start it if a patient has a stall, and I sprinkle in small doses for limited periods of time to help them get through a plateau or move on. Now, I have some mixed feelings about this, but I'm trying to capture a patient population where I can influence them with the low carb, with the intermittent fasting, with the strength training. And quite honestly, try to save them from going down that road where they're only doing medicine, because there's only a limited number of practitioners out there like me that are using these medications in a prudent manner. Um, I think they're good medicines. I think this is just a prediction. I think they're going to become the most prescribed medicines in the history of the world. I know that's a mouthful. I think previously that has been statins, but again, the genie's out of the bottle, and I think that these medicines will do good for a lot of people for a variety of indications. But it's really incumbent on both patient and medical provider to commit to using them prudently.
Wow. Statins, you should be on your toes, man. Statins, we're coming after you.
Yeah.
That's great. That's a boggling thought, knowing how big the statin industry is. That I agree with you, and it might be a scary short amount of time that that's the case.
Yeah. Yeah. So, I mean, it's just, I mean, again, I think people are going to use these. And so I'm, hopeful that there's a group of practitioners out there that will guide their patients in using them, because there's kind of two approaches right now. And I'll define my approach that we've just described as a third one. The one approach is just go to the internet and get it. A lot of people are doing that, and there's no program. It's just, you'll meet with a provider every 6 months. And then the other aspect is some of the primary care docs that are adding it on to the regimen of the other patients, of the patient's medications. And again, I don't want to be negative about the primary care docs, because they're busting their butt in the office every day, taking great care of people. I got a lot of friends that are primary care providers, but they usually don't have the means to utilize these medicines for weight loss within a comprehensive program like we've talked about.
Yeah. Okay. I really appreciate that. You mentioned that you pretty much always start with lifestyle interventions, or you start with them and you don't prescribe this. What would be a good example of a situation? Again, I know this is very high level and this is not medical advice, but like, what would be a typical person where you might, like, maybe sooner rather than later, introduce this into their program?
Yeah, I think if their weight or their blood sugar, because again, these medications control blood sugar, is affecting their health already. And they've made an effort with a variety of, lifestyle changes, approaches. A lot of times it relates to working through the frustration of a stall. They've lost 15 or 20 pounds, they've done great, and now they're still staying with the program. They're doing everything they can, and they're frustrated. They got another 40, 60 pounds to lose. That would be a common situation that I use them. But I don't know if, so your listeners understand how these medications are used. It's a once weekly injection that's titrated up over a period of months. Start a low dose month 1, move to another dose month 2, another dose month 3, another dose month 4, up to 5 or 6 months. Um, and so what I do is I use lower doses, and I try and keep everybody at a lower dose. Most of my patients are at about half the maximum dose on this, the patients that I treat, which is a minority of my patient population. Um, and we get them up to a certain level, and we don't go higher. And then we start talking about what is the plan for coming down. It's like, since you're in Utah, it's the Stephen Covey thing, who is from Utah. Stephen Covey, the 7 habits of, what is it? 7 habits of highly effective
Highly.
people.
Yeah. Yep. Nailed
Is
it.
Yeah. So I know he's from out there, and I read his book 25 years ago. And one of his comments, one of his rules that always stuck with me was begin with the end in mind. Okay, so if you're going to start this medication, begin with the end in mind. And the end in mind is to get off the medication. And the end in mind also is to maintain or build your muscle mass, which means you have to be 100%, you have to be strength training and getting adequate protein if you're on these medicines. If not, you're going to lose significant muscle mass. And then you need to prepare for the day when you come off, and avoid that weight regain. And the patients that I've had that have been on the medicine low doses and then off it, their lifestyle has changed, and they've been able to maintain their lower weights. But it's only because they're doing all the other things that they need to do to stay there.
That makes sense. So that's why you're not seeing the regain that you're seeing with other people. Not only is it a lower dose, it's a temporary plan at the very least, but they're doing other things to avoid that muscle wasting effect that we're seeing.
Yeah. Yeah, and you gave an intro that was appropriate. It's like everybody's always looking for the magic pill here. This literally is being viewed by some people as the magic pill. It's a magic shot right now, but the pills are coming here in the next couple of years of the same type of medicine. There is no magic pill. You're always going to be giving up something here, and in this case it's the muscle mass and the weight regain. And then I don't have a problem with a lot of my patients with side effects, but if you read about the nausea and vomiting and the potential risk of those side effects, I keep my patients at lower doses, so I really don't have a lot of issues related to that.
Okay, good to know. That's great.
Yeah.
The normal recommendations for when somebody should start this. I believe it's a BMI of over, I think, 30 without comorbidities. I know the American Pediatrics Association is now recommending if a child is showing signs of obesity at age 12, they can be prescribed. How are you feeling in general about like these kind of like preliminary cutoffs? Do you think they're strict enough, not quite strict enough? What is your personal opinion about that?
So there are two sides of that. I think the BMI of 30 is fine. 27 with comorbidities. Sometimes I see patients that come to me and they've had like a little bit of a high cholesterol and a BMI of 27 and a half. I discourage them from using the medicines. I have not used it in pediatric patients. Though I think that's coming. I think anybody that does that needs to be really, really careful about not taking a 12-year-old and putting them on a medicine for the next, 80 years or whatever. So with that age group, it's going to be critical that they begin to understand the lifestyle considerations. So I'm not treating any pediatric patients. Quite honestly, I've had 19 and 20-year-olds that I've treated with just all I did for 5 years was the CGM, low carb, intermittent fasting, strength training approach. And I had a 19-year-old that lost 60 pounds,
Wow.
went from 270 to 210. So it can be done. So you got to be careful. The medicine, it can be effective, but it's a crutch. And just like if you sprain your ankle, you need a crutch for a while, but you want to be able to throw it away at some point.
Yeah, I love that. We don't have to worry about the kiddos so much because now at age 13, they're recommending that they can get gastric bypass surgery. So if the Ozempic doesn't work for a year and they're going to be on it for the rest of their life, at least we can forever change their intestines. So if we've got that, you just need to wait 12 months.
I mean, and I also have patients that are on this medicine and they stall on the medicine. It's like you got to do more. I do have some patients where, they want to take the medicine and figure everything else will take care of itself. So you got to stay on it, and they get frustrated. It's like, you are not going to move the dial. There are some people, not my patients because I don't use maximal doses, but there are patients on maximal doses and they still aren't losing the weight they want because
Wow.
it doesn't work by itself.
Yeah, the muscle thing is so important. We're now seeing the pictures of like the face kind of sagging on some people that have been
Yeah,
taking it for
yeah.
a little bit longer.